Hi everyone, this is an anatomy and physiology video for healthcare students. In this one, we'll be talking about blood typing. There is a separate video for blood typing with unknowns. So first off, blood groups, there's a number of them. We're going to discuss the ABO blood group and the Rh or D blood group. But, there's actually about 30 or more different blood groups, so we're only going to be focusing on just those two. We need to lay some groundwork to understand blood typing, and we need to understand a couple of terms, antigens and antibodies. So antigens are surface features on cells. Oftentimes they help our immune system or our white blood cells identify cells as our own. Some of those surface features are glycoproteins, glycolipids, carbohydrates, even protein groups on the surfaces of our blood cells. So when we talk about tissue typing or blood typing, we're looking at these surface features called antigens that help us identify whether or not a blood cell belongs to us or potentially could be a foreign blood type. So a foreign antigen will cause our immune system to generate an antibody. Now, antibodies are built specifically against a particular antigen. The shape is like a lock and key fit. In this image, you'll notice there's 6 different antigens pictured. If you look very closely at the tip end of those antibodies, shaped like a Y, the antibody shape is built specific to that antigen. So that's what an antibody does, is it fights, it binds, and it agglutinates foreign antigens. So, for instance, if you have caught the flu virus, your body will identify that flu virus as a foreign antigen. It will in turn build antibodies very specific to the shape of that flu virus to fight it and get rid of it. That's why if the flu virus changes, mutates, evolves, then every year we need a flu shot because that helps us generate antibodies specific to that particular design of the virus, those antigens. This image is a common graphic that you may see in many textbooks. In this image, for instance, blood type A, they're just using circles to illustrate the antigens, whereas blood type B, they're using green triangles to illustrate the antigens. If you compare the shape of the antigen to the binding part of the antibody, you'll notice that they're meant to be kind of like a lock and key fit. Those antibodies are built specifically to bind with a particular antigen. So antibodies are not one size fits all. They're built very specific to the antigen that they will bind. So the process of agglutination occurs when antigens are bound by antibodies. Some of our antigens are considered self, but when antibodies bind foreign antigens, that's when we see this clumping that takes place. So like I mentioned, those antibodies are specific. This is an anti-B antibody. It is binding to a B antigen. So if we're talking about blood typing and compatibility, if there's a possibility for agglutination, then those blood types are not compatible. We should not give blood types as a donor if there's a potential for antibodies to agglutinate. Let's do an example of a transfusion reaction. So let's say that my blood type is A. I'm going to receive a transfusion of blood type B. So you'll notice I've just used the letters A for my antigens and letter B for my foreign transfusion. So right now, these anti-B antibodies will bind those foreign antigens. This is called cross-linking. It's a transfusion reaction, and this clump of blood cells travels through our body's small vessels called capillaries. Unfortunately, this can rip up those capillaries and create damage. So if we happen to have a transfusion reaction, we can see capillary damage, especially in places like our capillaries of the kidneys. If we were doing an actual blood typing, you might see agglutination-like letter or anti-A and anti-D in this image. So in this image, we are looking at letter or anti-B as being not agglutinated, but the other two examples, those are clumping reactions that take place there. I'm really cautious about using the word clumping because it gets into sounding like blood clotting, and that is not what we're looking at. Blood clotting or hemostasis is an entirely separate process or mechanism. What we're covering here is just agglutination, meaning we are looking at antibodies binding foreign antigens. So one way to learn this material is by completing a chart like this one. And I'm going to do a few for you. You may want to pause and then see if you can complete the rest on your own. I am going to answer all this chart, and then you can use that to lean on as you start practicing blood typing. When you know you've got this material is when you cannot rely on the chart to do the answers. That's ultimately where you want to move yourself. If you have to reference back to a chart like this to answer questions, you don't have it well enough seated in your mind to be able to pass a quiz or a test. So I would use this just to start with. Okay, so let's take row 1. That is blood type A positive. We're going to combine the ABO blood group with the Rh blood group. So Rh, you either have the antigen and are called Rh positive, or you lack the antigen and you're called Rh negative. We alternately call the Rh factor the D factor, so you'll see that used interchangeably when we talk about the Rh antigen. So on this blood cell, I'm just using letters to illustrate what we've got. So A for the ABO blood group and Rh are present. So that's A positive. We are positive we do have that Rh factor. Those are our antigens. Now, the only other antigen that we don't carry is B. So by the time you're around 5 years old, you have become sensitized through living in the world, through the environment, to any of the A, B antigens that you don't carry. And since we don't carry B, we're going to form anti-B antibodies. Those are circulating even if you've never had a transfusion. So when we talk about receiving blood during a transfusion, A positive is compatible antigen-wise with A positive, A negative, O positive, and O negative. O carries neither antigen A nor antigen B. So the catch is we can't necessarily combine antigens that aren't compatible, that don't mix, because we might create a case of agglutination. So that's why we cannot receive any blood type with B. We carry that anti-B antibody. We would agglutinate any blood type with B. So no B positive, no to B negative, definitely not the ABs because of that reason. Sometimes on quizzes and tests, you may be asked to identify whose blood you can give to. So let's say that you walk into the Red Cross and you say, hey, I'm here to donate blood. I'm A positive. I'm just curious who can receive my blood in a transfusion. So keep in mind, we're giving this blood away. We want to know who those recipients might be. So the catch is they have to recognize your antigens. You have antigen A and you have the Rh factor. So you can give it to your own blood type, A positive. You can also give it to AB positive. That's because AB positive recognizes your antigens, A and Rh. You may want to pause the video and try doing A negative. If you're not quite yet comfortable, let's keep rolling. So let's talk about A negative. What it means to be negative is that you don't have the Rh factor or that antigen. It's just like if you go in for a flu test and they say, hey, great news, you don't have the flu, you're negative for the flu. You don't carry that antigen in your body. So here, if you're Rh negative, you just don't carry that Rh antigen. So the only antigen we're looking at is A. Now here's the catch about antibodies. Like with A positive, By the time we're a little kid, 5 years old, we're going to have formed anti-B antibodies in our bloodstream. We are sensitized through living in the environment. The only time, however, that you will make anti-Rh antibodies is upon exposure, either through a transfusion or if you're a female who is negative and you are pregnant with a positive baby. So we can say, yeah, you've got anti-B antibodies and you may form anti-Rh upon exposure. So if you need a transfusion, you can receive your own blood type, A negative. You can also receive O negative. O negative, you're going to see quite often. It is the universal donor. That means it donates to everyone. Let's turn the tables. Let's say you walk in the Red Cross, you're here for a donation. You find out you're A negative, and you can give your blood away to your own type. The catch is whoever you give your blood to must recognize your antigens. We only have antigen A, so A positive recognizes the A antigen. So does AB negative and AB positive. Now, if we've worked far enough for you to start to feel a little comfortable, try completing B positive and B negative. If not, let's keep working. So B positive has two antigens, the B antigen and the Rh factor. Positive means you have got that antigen. So you are positive for the Rh factor, or otherwise called the D factor. Now, for us, the A antigen is foreign, so we'll form an anti-A antibody. Same scenario, by the time you're a little kid, about age 5, you will have formed anti-A antibodies. Again, if you walk in and need a transfusion for surgery, you can always receive your own blood type. You can receive B negative, O positive, and also that universal donor, O negative. And again, flip the tables. Now you're walking in the Red Cross to give a donation. You can always give to your own blood type B positive. You can also give it to AB positive. The catch is they need to be able to match your antigens. So AB positive has seen your B and your Rh antigens. B negative carries no Rh factor. It only has the B antigen, no Rh antigen here. And like with the A, if you have B negative blood, you will form an anti-A antibody by the time you're around age 5. And then upon exposure, either through a transfusion or through pregnancy as a negative female, you will form an anti-Rh antibody. Okay, so if you need a transfusion, it's limited. It's B negative and O negative. Why can't you get positive blood? Well, positive blood would trigger you to build an anti-Rh antibody. So notice there is no positive blood on our receive from list. Now, you can give your blood to a positive person because you're only giving them the B antigen. You're not giving them anything that's foreign. So a B positive person is receiving your B antigen, and that's it. An AB positive person is just receiving your B antigen, and that's it. So you're not giving anything foreign to those blood types. You're just giving them an antigen that they're already familiar with. There's 4 more. These are AB positive, AB negative, O positive, and O negative. If you feel comfortable, you may want to pause the video and go ahead and complete these on your own. If you're still kind of getting your bearings straight, let's walk through these together. So AB positive blood has all 3 antigens, A antigen, B, and Rh factor. That means this person builds no antibodies. The only antigens we've been discussing for these 2 groups are the A and B antigens for the ABO blood group and the Rh antigen for the Rh blood group. So yeah, we've got all the antigens, no antibodies are formed. This one is considered the universal recipient. That means this blood type is, always going to have a compatible blood available to them. If they need a transfusion during surgery, there is one available. You'll notice all 8 blood types can be transfused. So since we have no antibodies, there is nothing for us to fight. So all of these blood types are compatible. The only disadvantage is you're limited in donating your blood, say at a Red Cross site. So if you're donating your blood to someone else, the only type that's compatible would be your own, because AB positive is the only one that has seen all 3 of your antigens. Let's take a look at AB negative. Only difference here, there's no Rh factor, so upon exposure, we would build anti-Rh antibodies. I hope you're getting the swing of things, because if you're negative, you can only get negative blood. And of course, if you're giving it away, AB negative can give to positive blood, because we're only giving that person A antigen and B antigen. We're not introducing anything foreign if we're donating it to AB positive blood. All right, let's do the O's. So O positive carries an Rh antigen only. That's it. This one would have already in the bloodstream anti-A and anti-B antibodies. So if we do a transfusion, the immune system is primed. It has antibodies available. We do not have to wait for the immune system to build those antibodies. They're ready. Okay, so we can receive only O positive and O negative blood. But of course, you can give this to pretty much any positive type. So you can give it to A positive, B positive, AB positive, and yourself O positive. All right, and the last one there, you'll notice there are no antigens on that red blood cell. That's because this one carries nothing. No A antigen, no B antigen, no Rh factor. So O negative has in the blood plasma already available anti-A, anti-B antibodies, and upon exposure, perhaps through transfusion or pregnancy, will form anti-Rh antibodies. So unfortunately, this means that O negative can only receive their own. Now in the United States, O negative is actually um, it's pretty rare because it's got that negative, association there with it. But this is sought after because if you walk in the Red Cross and you say, hey, I'm O negative, you're the universal donor. This can be donated to anyone due to antigen compatibility. That means if you give O negative to any of our 8 blood types that we've discussed today, there is nothing that's going to set off an immune response antigen-wise. So you can give this to anybody as the universal donor. This image often pops up in books as a quick and easy way to remember the donation pathway. It works like this. So if you are blood type O, you can give it to A, AB, and B blood types. If you are A, you can give to AB. If you're B, you can give to AB. But notice the arrows don't go in the opposite direction. If you're AB, you can receive. If you're O, you can donate. So it's a great, easy way to remember the universal donor is O and the universal recipient is AB. You may want to pause the video, see if you can answer these questions. When you're ready, go ahead and hit play, and then we'll go over the answers. So on this screen, we are just looking at who you can receive from. A positive can get A positive, A negative, O positive, and O negative blood. Notice we are not receiving anything with B because A positive carries an anti-B antibody. We would fight and agglutinate any blood type with the B antigen. What did you get for the next one? What blood type can O negative receive? Only O negative, right? This is limited because we carry an anti-A and an anti-B antibody, and we would build against anti-Rh upon exposure. So yeah, we can't really get any of those other antigens. All right, AB negative can get the negatives. Why can't this one receive any positive blood? We would build anti-Rh antibodies upon exposure. So we cannot get that particular antigen. It would trigger our immune system to build and fight against those foreign antigens, which in this case would be an Rh antigen. What did you get for B negative? B negative can receive B negative and O negative. What about AB positive? Well, this one can receive all types. So would you consider this the universal recipient or is it the universal donor? Since it can receive everything, it's the universal recipient. Now, O positive can receive O positive and O negative. Why can't we get anything that's A or B? That's because we already have present anti-A and anti-B antibodies that would fight against any blood type containing those antigens. All right, finally, A negative can receive A negative and O negative. That is it. Can't receive anything positive because it would cause us to build anti-Rh antibodies, nor can we get anything with B because we do already contain those anti-B antibodies. We would agglutinate. I hope this video was helpful for you. There is a separate video on blood typing unknowns. So if you do want to watch more about how to do that, check out my other video. So if you like my video, please follow my channel and leave any questions in the comments for me.